myeloid cells. Okay, anemia of chronic disease it's going to be the same, right? Chronically, when there is when a person is suffering from any chronic disease, it's going to affect the reticulocyte production as well. There's some glitch. सुनिरहेको छ There is some glitch in my application. Okay, now macrocytic anemia size is going to be greater than 100 femtoliters. Right? As I've said earlier, size should be between 80 to 100. Macrocytic is going to be greater than 100. So, यो चाहिँ केमा हुन्छ त एउटा megaloblastic anemia भन्ने हुन्छ अर्को non-megaloblastic anemia. Right? Megaloblastic anemia has to do with vitamin B12 or folic acid deficiency. यसमा चाहिँ megaloblasts form हुने भएकोले we call it megaloblastic anemia. यसको चाहिँ specifically what we find here भन्दाखेरि चाहिँ hypersegmented neutrophils we find it here. Right? Non-megaloblastic anemia मा पनि RBCs को size चाहिँ it's going to be big. तर there's not going to be hypersegmented neutrophils, non-megaloblastic anemia ma. But megaloblastic anemia there's going to be hypersegmented neutrophils. Non-megaloblastic anemia चाहिँ केले गर्दाखेरि हुन्छ त एउटा reticulocytosis मा पनि हुन्छ because these are immature cells, immature RBCs भएकोले चाहिँ they have not gotten enough time to mature. त्यही भएर चाहिँ यिनीहरुको साइज ठुलै नै भइराख्छ कि division हुने टाइम पाएको हुँदैन. So reticulocytosis मा पनि macrocytic anemia हुन्छ. Hypothyroidism मा पनि macrocytic anemia हुन्छ अघि नभनेको जस्तै यसले चाहिँ एउटा के गर्छ त folic acid र vitamin B12 को absorption लाई decrease गराउने भयो and it's also going to depress the bone marrow. It's going to suppress the bone marrow activity. हैन alcoholism मा पनि macrocytic anemia हुन सक्छ. So this is a brief overview of the morphological classification. Now let's talk about the symptoms. You say general symptoms it can occur in any types of anemia, any type of anemia. The fatigue because the body is not being able to carry enough oxygen, headache pallor the person is going to look pale. अनि पछि गएर चाहिँ के पनि गर्न सक्छ त एनेमियाले भन्दाखेरि irregular heartbeat पनि गर्न सक्छ, arrhythmia पनि गराउन सक्छ. That means, right? And then, as I've said earlier in my previous lectures, heart ले चाहिँ first मा supply गर्ने organ भनेको के हो त? It's the heart itself, right? So heart मा पनि blood supply कम भएर पछि angina पनि हुन सक्छ oxygen hypoxia भएर So anemia could also lead to angina, chest pain हुन सक्छ. The cold hands हुन सक्छ, dizziness हुन सक्छ. The person could be so weak he could be having leg cramps, insomnia हुन सक्छ. So these of breath भइहाल्यो. So these are all the symptoms of anemia. All kinds of anemia could show these symptoms. Now let's talk about one of the commonest type of anemia. The iron level के हो त भन्दाखेरि एउटा त physiological state मा हुन सक्छ when there is increased demand such as in pregnancy अनि childhood जति बेला चाहिँ growth spurt भइरहेको हुन्छ त्यति बेला increased demand हुन्छ नि त iron को. So that's also going to cause iron deficiency anemia. अर्को चाहिँ blood loss भइरहेको बेलामा such as in menorrhagia, inflammatory bowel disease मा हुन सक्छ, peptic ulcer disease मा हुन सक्छ because of blood loss, GI malignancies मा हुन सक्छ, or if you have donated blood, त्यो केसमा पनि iron deficiency anemia हुन सक्छ. अर्को चाहिँ we have poor intake, poor intake हुँदा पनि iron deficiency anemia हुन सक्छ, or poor absorption, whenever you nutrient deficiency either there is poor intake or poor absorption. Poor absorption चाहिँ कस्तो cases मा हुने भयो त gastric bypass surgery मा हुन सक्छ, अनि gastritis मा हुन सक्छ, Helicobacter pylori infection मा हुन सक्छ, Antacids use ma huna saksa, high caffeine consumption. I'm just naming it out because today's lecture is going to be very long. Alkati long so I'm just naming it out because we all know the poor absorption parasitic infection obviously inflammation भएर पोर हुने हो हैन सेल त्यो लाइनिङ इन्फ्लेम्ड भएपछि पोर absorption हुने हो celiac disease मा पनि त्यही हुने हो हैन high caffeine consumption. Okay, now how do we diagnose iron deficiency anemia है त lab test मा चाहिँ what do we see भन्दाखेरि चाहिँ यो चाहिँ initial testहरु भयो है usually any kind of anemia like say first मा हामीले initial screening testहरु चाहिँ यही गर्ने हो. The first thing we look at is hemoglobin. Okay, iron deficiency anemia मा hemoglobin is going to be decreased. Then there is something called RDW. यो भनेको चाहिँ red cell distribution को width हो है. यसले चाहिँ के हेर्छ त भन्दाखेरि the variation in the red cells width. Variation भन्दाखेरि चाहिँ कुनै चाहिँ microcytic छ अरे कुनै monocytic छ कुनै macrocytic छ भने it is very much varied नि त अनि त्यस्तो केसमा चाहिँ RDW high आउन सक्छ है. यसमा पनि के हुने भयो त iron deficiency anemia मा पनि के हुन्छ त भन्दाखेरि there's not just going to be normocytic cells over there, there's going to be microcytic cells as well, so variation is going to be high. त्यही भएर iron deficiency anemia मा RDW is going to increase है. Hemoglobin decrease, RDW is going to increase because there's going to be a wide varieties of red blood cells. Some are going to be microcytic, but there could be also normal cells. हैन पहिलेदेखि नै iron पहिले normal हुँदाखेरिको normal cells could also be there because RBC को lifespan is 120 days, right? So mean corpuscular volume, as we said earlier, microcytic anemia हो, so यसको size decrease भएपछि यसको volume पनि decrease हुनु पर्यो. Right. So less than 80 femtoliters हुने भयो microcytic anemia भएकोले. And then there is something called mean corpuscular hemoglobin. यसमा चाहिँ red blood cells मा hemoglobin concentration यसले चाहिँ त्यो गर्छ denote गर्छ है. Mean corpuscular hemoglobin is also going to decrease. Mean corpuscular hemoglobin concentration is also similar to mean corpuscular hemoglobin, but यो चाहिँ एउटा group of RBCs को concentration भयो है. यो पनि decrease हुन्छ. RBC count obviously is going to decrease. हैन. And then there is reticulocyte count. So reticulocyte count is also going to decrease किनभने our body is not being able to produce enough RBCs. त्यही भएर reticulocyte count पनि decrease हुन्छ. WBC is going to remain normal. Platelet चाहिँ कस्तो केसमा मात्र decrease हुन्छ त भन्दा if there is too much consumption of platelets in case of chronic blood loss. Hey, अघि भनेको जस्तो iron deficiency anemia चाहिँ let us suppose chronic के भन्छ inflammatory bowel disease ले गर्दा हो भने कहिलेकाहीँ platelets पनि consume भएर हैन के हुन सक्छ त decrease हुन सक्छ. Now there is something called diagnostic test for iron deficiency anemia है. So what is serum ferritin? Ferritin भनेको चाहिँ storage form of iron हो है. Body मा चाहिँ ferritin form मा stored हुन्छ. So storage form पनि decrease हुने भयो. Serum iron is obviously going to decrease. अनि त्यसपछि चाहिँ iron जब decrease भइरहेको छ भने body is going to want to combine with more iron, right? It's going to want to bind with more iron नि त. त्यही भएर चाहिँ total iron binding capacity चाहिँ increase हुन्छ यस्तो केसमा है. Serum ferritin decrease भइरहेको छ, serum iron decrease भइरहेको छ, त्यही भएर bodyलाई चाहिँ अझै धेरै iron bind गर्नुपर्ने necessity छ नि त bodyको. So total iron binding capacity is going to increase. अनि transferrin saturation भनेको चाहिँ के हो त भन्दा serum iron divided by total iron binding capacity हो है. यसको formula चाहिँ serum iron divided by total iron binding capacity. So serum iron decrease भयो र TIBC increase भयो भने obviously transferrin saturation is going to decrease. This divided by this. So transferrin saturation is going to decrease. हैन. Then we have some special tests है. यसले चाहिँ के गर्छ त भन्दाखेरि it is going to show our protoporphyrin level, right? Zinc protoporphyrin छ अनि अर्को चाहिँ free protoporphyrin छ है. So as I've said earlier in this figure, heme is formed of iron plus protoporphyrin. So when our body lacks iron, then what's going to happen? protoporphyrin is going to be free in our blood cells, right? So we can also test for protoporphyrin, but then these tests, it's going to be expensive. I don't think we use it here, hey? Is to test saru. So यो टेस्ट पनि गर्न सकिन्छ है. These are some special tests. Bone marrow iron stores पनि हेर्न सकिन्छ, or bone marrow morphology पनि हेर्न सकिन्छ. But then we really don't need to do this when we can diagnose it by just looking at our iron stores है. के गर्ने त bone marrow morphology मा चाहिँ hypercellular हुन्छ initially because the body lacks RBCs. So के हुन्छ त भन्दा bone marrow activity increase भएर चाहिँ hypercellular हुन सक्छ. But later चाहिँ के हुन सक्छ त भन्दाखेरि चाहिँ it's going to be, it can also be hypocellular later on, hey, when there is too much depletion of iron and the bone marrow is not being able to utilize it to produce RBCs, है, पछि गएर hypocellular पनि हुन सक्छ. Now let's talk about the treatment. Okay, the first thing we have got to do is correct the underlying etiology, है. अब bleeding, active form of bleeding कतै छ भने पहिला त्यसलाई stop गर्नु पर्यो instead of just giving iron to that person, right? So correct the underlying etiology. त्यसपछि के गर्ने? Iron supplementations दिन सकिन्छ either in oral form or in parenteral form. Oral form मा चाहिँ there is polysaccharide iron complex, ferrous gluconate पनि हुन्छ अनि ferrous sulfate पनि हुन्छ है त. So your oral preparations को चाहिँ there is one side effect, यसले चाहिँ GI irritation अलिकति गराउन सक्छ अनि compliance could be a little low है, especially in children, है. Compliance low हुन सक्छ. यस्तो केसमा we can also give parenteral iron, right? त्यस्तो केसमा, or if there is too much bleeding and the person's supposed to get iron real fast, त्यस्तो केसमा पनि हामीले parenteral iron दिन सक्छौं. But not in all cases we give parenteral iron, है त. त्यसपछि चाहिँ let's talk about megaloblastic anemia. So अघि भने जस्तै megaloblastic anemia चाहिँ कि त folate deficiency ले गर्दाखेरि हुन्छ कि त vitamin B12 deficiency ले गर्दाखेरि हुन्छ. So any nutrient deficiency, what's going to happen? Either there is decreased intake or there is decreased absorption, right? So decreased intake हुन सक्छ or increased requirement हुन सक्छ. Increased requirement चाहिँ कस्तो कस्तो केसेसमा हुन सक्छ त भन्दाखेरि increased cell turnover को केसमा such as chronic hemolysis, कि त pregnant woman को केसमा हुन सक्छ हैन, increased requirement त्यसले गर्दा नि folate deficiency हुन सक्छ, or impaired absorption, है. Or there could be excess loss such as the patients undergoing hemodialysis, है, त्यस्तो केसमा चाहिँ bloodबाट चाहिँ excess folate चाहिँ loss भएको हुन सक्छ. कि त drugs such as methotrexate and hydroxyurea, these are the methotrexate भनेको anti-folate drug भयो, so this, it is going to cause folate deficiency. And there's another one, hey, which is vitamin B12 deficiency. यसमा पनि decreased intake हुने भयो vegans-हरुमा, vegetarians-हरुमा, हैन, हुन सक्छ. So decreased absorption, hey, decreased absorption. So there is something very interesting over here. So vitamin B12 चाहिँ कसरी absorb हुन्छ त भन्दाखेरि हाम्रो the main site of vitamin B12 absorption is के त ileum हो. तर यो absorb गर्नलाई चाहिँ हामीलाई के चाहिन्छ त भन्दाखेरि stomach को lining parietal cells ले चाहिँ एउटा intrinsic factor भन्ने factor चाहिँ produce गर्छ, and this is very much essential for vitamin B12 absorption, है. So यो intrinsic factor सँग bind भएर vitamin B12 absorb हुने हो नि त. But your pernicious anemia मा चाहिँ there is antibodies, है. Antibodies हुन्छ के को against त भन्दाखेरि यही parietal cells को against चाहिँ antibodies form हुन्छ, है, and also antibodies against the intrinsic factor. त्यसले गर्दाखेरि चाहिँ vitamin B12 absorption हुन सक्दैन. And there is something called Zollinger-Ellison syndrome. यो चाहिँ एउटा pancreatic cancer हो जसले चाहिँ gastrin एकदमै धेरै produce गर्छ, gastrin धेरै produce गरेर. So this is also going to interrupt the vitamin B12 absorption, है, यसले decrease गराउन सक्छ, है. अर्को चाहिँ intestinal causes, अघि भने जस्तै ileumबाट हो नि त absorb हुने vitamin B12. So ileal resection गर्यो भने पनि there is going to be vitamin B12 deficiency. Now, clinical picture of megaloblastic anemia. Right. So megaloblastic anemia, there is going to be pancytopenia, not just anemia, but there is going to be pancytopenia. Again, first let me tell you, megaloblastic anemia. Okay, folic acid र vitamin B12 deficiency ले चाहिँ किन macrocytic anemia गराउँछ भन्दाखेरि चाहिँ यसले चाहिँ के गराउँछ त भन्दा DNA synthesis like there's going to be impairment of DNA synthesis in case of deficiency of folic acid and vitamin B12, right? And when there is impairment of DNA synthesis, so what's going to happen is our cells won't be able to undergo mitosis, right? So cells say हाम्रो bigger size में भइरहेको छ के the cells they are not being able to divide त्यसले गर्दाखेरि चाहिँ macrocytosis हुने हो है किनभने यो त macrocytic anemia हो नि त यो megaloblastic anemia is a macrocytic anemia यसमा चाहिँ के हुन्छ त भन्दाखेरि हाम्रो impairment of DNA synthesis हुन्छ so that is the reason why our cells are not being able to divide Hi. It's going to affect all three of our cells, right? It's going to affect our red blood cells, our white blood cells, and also our platelets, right? Because it is going to impair DNA synthesis. So one thing we have got to remember is pathogenesis matte, impair DNA synthesis. Hi. GIT मा चाहिँ what's going to happen? Atrophic glossitis हुन सक्छ. Our tongue, हाम्रो tongue चाहिँ beefy red हुन सक्छ कि त gastric atrophy हुन सक्छ. Again, यो चाहिँ pernicious anemia सँगै related हुन सक्छ most of the times यो हाम्रो gastric atrophy चाहिँ अनि nervous system मा चाहिँ especially B12 ले affect गर्छ है के गर्छ त भन्दा peripheral neuropathy गराउन सक्छ because B12 is very much essential for myelin sheath formation है myelin sheath formation को लागि चाहिँ B12 एउटा essential component हो so B12 deficiency भयो भने चाहिँ के हुन्छ त peripheral neuropathy हुन सक्छ and there could also be subacute combined degeneration And why do we call it combined? Because it affects both lateral and dorsal columns, right? So, this is the clinical picture of megaloblastic anemia. And on top of all the other symptoms and signs that we talked about, again, previously, symptoms are on top of this, megaloblastic anemia ko specifically pancytopenia, GIT ma, atrophic glossitis, gastric atrophy, अनि peripheral neuropathy गराउँछ र subacute combined degeneration पनि गराउँछ है. And there is something, okay, investigations how do we know if it's folate deficiency or vitamin B12 deficiency है त. एउटा चाहिँ bone marrow examine गर्दाखेरि चाहिँ we are going to be finding हैन erythroid hyperplasia है hyperplastic हुन्छ bone marrow अनि presence of megaloblasts अघि भनेको जस्तै megaloblasts are the cells हैन त्यसमा चाहिँ specifically कसरी पत्ता लगाउने that this is a megaloblast भन्दाखेरि चाहिँ megaloblasts have hypersegmented neutrophils यो पनि केले गर्दाखेरि हुने हो त भन्दा defective DNA synthesis ले गर्दाखेरि हुने हो है So serum vitamin B12 is going to be normal in folate deficiency and it's going to be decreased in vitamin B12 deficiency. And obviously, serum folate deficiency ho bhane your folate decrease huncha यसमा normal huncha. Now there's something very important है त यो vitamin B12 ले चाहिँ के गर्छ त भन्दाखेरि चाहिँ हाम्रो Krebs cycle मा vitamin B12 is responsible for the conversion of methyl malonyl CoA to succinyl-CoA है त methyl malonyl CoA लाई succinyl CoA मा convert गर्न चाहिँ vitamin B12 को utilization हुन्छ so when there is deficiency of vitamin B12 के हुन्छ त methyl malonyl CoA चाहिँ blood मा increase हुन्छ है just remember this particular step है अरु केही extra steps we don't need to remember methyl malonyl CoA लाई चाहिँ succinyl CoA मा जाँदाखेरि चाहिँ we need vitamin B12 and also it's the same for homocysteine and methionine है homocysteine to methionine मा convert गर्दाखेरि चाहिँ we need vitamin B12 so vitamin B12 को deficiency ले के हुने भयो त भन्दाखेरि there's going to be accumulation of methyl malonyl CoA and homocysteine in blood है यो दुईटा कुरा चाहिँ accumulation हुने भयो so this I've mentioned it in the table these two things so यसले गर्दाखेरि चाहिँ we can also differentiate between folic acid deficiency and vitamin B12 deficiency, because in folic acid deficiency, there is going to be normal serum methyl malonic acid, right? But it's going to be increased in vitamin B12. But homocysteine is going to be increased in both folate deficiency and also it's going to be increased in vitamin B12 deficiency. Hey, so we need to remember this important thing. Methylmalonic acid ले चाहिँ के differentiate गर्न help गर्छ त भन्दा folate deficiency and vitamin B12 deficiency, because in vitamin B12 deficiency, methylmalonic acid is going to be increased. Right? Now, antibodies to the intrinsic factor and gastric parietal cells. So obviously this is going to be absent in folate deficiency and it's going to be present in pernicious anemia. Now, serum gastrin. Serum gastrin is going to be normal, but in vitamin B12 deficiency as a feedback, right? In case of pernicious anemia, because pernicious anemia ma ochlorhydria पनि हुन सक्छ, so as a feedback, gastrin secretion चाहिँ increase हुन सक्छ. Serum gastrin could be high. Now, gastric analysis, normal, right? And achlorhydria in case of pernicious anemia. And stool analysis for parasites. So there is something called fish tapeworm, right? त्यसलाई चाहिँ हामी Diphyllobothrium latum पनि भन्छौँ. यो fish tapewormले चाहिँ कहिलेकाहीँ vitamin B12 deficiency गराउन सक्छ if you have ingested it, right? If there is recent history of ingestion of this of fish, right? Diphyllobothrium latumले गर्दाखेरि पनि vitamin B12 deficiency हुन सक्छ. Okay, now let's talk about a very important test. Use the skilling test हो है. Okay, the Schilling test चाहिँ के छ त भन्दाखेरि it is related यो testले चाहिँ के देखाउँछ त भन्दा if a person has pernicious anemia or not. So how do we do this test भन्दा patientलाई चाहिँ we give them radioactive cobalamin. Right? The patient is supposed to ingest radioactive cobalamin. अनि त्यसपछि चाहिँ उसको 24-hour को चाहिँ urine radioactivity we are going to measure, right? After ingestion of radioactive cobalamin. 24 घण्टामा चाहिँ उसको urine मा चाहिँ त्यो cobalamin देखिन्छ कि देखिँदैन, we have to look for it, right? अनि if excretion of this radioactive cobalamin is low, then यसले चाहिँ के indicate गर्छ त pernicious anemia indicate गर्छ. कसरी त भन्दाखेरि obviously in pernicious anemia there's going to be intrinsic factors deficiency. So the person is not being able to absorb the vitamin B12 he ingests. त्यसले गर्दाखेरि चाहिँ urine मा आउने भएन, उसले ingest गरेको absorb गर्न सकेन भने त urine मा पनि देखिँदैन नि त. It's going to go right out of his GI tract नि त. It's not going to go to his bloodstream and back to the renal tract नि त. त्यही भएर चाहिँ यो केसमा चाहिँ pernicious anemia हो भनेर पत्ता लगाउन सकिन्छ. And how do we confirm this test भन्दाखेरि चाहिँ then after this we add oral intrinsic factor, right? त्यसपछि add oral intrinsic factor and then repeat the test again. फेरि repeat गर्दाखेरि चाहिँ के हुन्छ त increased urinary radioactivity, है? त्यसपछि फेरि intrinsic factor दिइसकेपछि चाहिँ urinary radioactivity increase भयो भने चाहिँ यो चाहिँ के भयो त pernicious anemia confirm हुने भयो. Now let's talk about anemia of chronic disease. है, chronic diseases मा चाहिँ कसरी गएर anemia हुन्छ भनेर. So what happens in chronic disease is there's a chronic diseases, hey, such as autoimmune diseases, अनि पछि गएर chronic kidney diseases, chronic liver diseases, especially chronic inflammatory conditions. मा चाहिँ के हुन्छ त भन्दा liverले एउटा hormone or let's call it a protein हैन release गर्छ है, or peptide hormone release गर्छ, which is है liverले चाहिँ hepcidin release गर्छ. अनि यो hepcidinले चाहिँ के गर्छ त भन्दा hepcidinले चाहिँ mitochondriaबाट iron release हुन दिदैन है. It's going to keep all the iron inside the mitochondria itself. Why does it do that भन्दाखेरि चाहिँ in case of inflammation or in case of infection, the body doesn't want iron in the bloodstream. के को लागि भन्दा bodyले चाहिँ decrease गर्छ bioavailability of iron to the bacteria. Body wants to decrease its iron, the serum iron. Okay. Actually, ferritin चाहिँ high हुन्छ. There is going to be increased iron stores, right? But it doesn't let it out into the blood, right? सो यो हेप्सिडिनले के गर्ने भयो त भन्दाखेरि आइरनलाई चाहिँ माइटोकन्ड्रियामै ट्र्याप गरिराख्छ. Iron is not going to let out in the blood. Okay, the first thing that it does. The second thing that it does is it also decreases the iron absorption from the GI tract, right? त्यस्तो भएपछि चाहिँ के हुने भयो त भन्दा functional iron is going to be low. Serum ferrous iron हुन्छ नि जुन चाहिँ हाम्रो सेरममा हुन्छ, that's going to be low. But ferritin चाहिँ एकदमै high भइदिन्छ के यसमा चाहिँ है. The storage form of the iron is going to be very high. So in case of anemia of chronic disease, initially it's going to be normocytic. पछि गएर it's going to be microcytic. After all the iron stores have depleted, है पछि गएर microcytic पनि हुन सक्छ. So chronic disease भन्ने बित्तिकै one of the most important organ we should not forget is the kidney, because kidney is responsible for erythropoietin hormone formation, हैन. 80% of the erythropoietin hormone formation is from the kidney. So kidney disease को बेलामा चाहिँ के हुन्छ त भन्दा erythropoietin hormone formation पनि decrease भएर there's going to be defective erythropoiesis. No, almost always kidney disease is accompanied by anemia. Right? So we should remember this. Now, what happens in anemia of chronic disease? Iron studies say के देखाउँछ त भन्दाखेरि चाहिँ the first thing is there's going to be low serum iron, as I've told you earlier, right? किनभने आफ्नो iron reservesहरू सबै लुकाएर राखेको छ बडीमा. So there's going to be low serum iron. But despite there is low serum iron, नि त total iron bearing capacity चाहिँ बढ्दैन के, because there's already iron in the body. The body knows that we have already stored iron. Right? High serum ferritin छ नि त. So iron storage is already high, so that is the reason the total iron bearing capacity is still low. And low transferrin saturation. Why is that so? Because because the low serum iron is also low, and especially total iron bearing capacity is also low, so transferrin is also low. This पछि चाहिँ how do we treat anemia of chronic disease? The most important thing we need to do is treat the underlying cause. Right? Underlying cause treat भएपछि anemia पनि treat हुन्छ. And sometimes erythropoietin may also be helpful. Right? Some of the doctors, they also use erythropoietin. Right? Especially kidney diseases, they also use erythropoietin. But usually say you can start by treating the underlying cause. Right? There is something called aplastic anemia. Okay, aplastic anemia भनेको चाहिँ it's a form of pancytopenia, so it's a misnomer. Hey, यो चाहिँ it's not just anemia. There's going to be pancytopenia. यो चाहिँ केले गर्दाखेरि हुन्छ त भन्दाखेरि चाहिँ it's either congenital or it's acquired. Hey, congenital forms-हरु चाहिँ के हुन्छ त केले गर्दाखेरि हुन्छ भन्दाखेरि चाहिँ Fanconi anemia ले गर्दाखेरि हुन्छ. Right? Fanconi anemia मा चाहिँ there is going to be अरु के कस्तो अरु के देखिन्छ त भन्दाखेरि the child is going to be having strabismus, is going to have low set ears, अनि frequent infections हुन सक्छ. Deafness plus or minus, right? It's going to have abnormal thumbs, अनि distal radius कहिलेका absent पनि हुन सक्छ है. Abnormal thumbs, or sometimes the thumbs may be absent. Also distal radius मा पनि abnormality हुन सक्छ. Hypopigmentation हुन सक्छ, freckles हुन सक्छ, right? So these are all that could accompany the Fanconi anemia, है त. This is congenital, है. Congenital form of aplastic anemia. अर्को चाहिँ हुन्छ acquired, हैन. Acquired चाहिँ केले गर्दाखेरि हुन्छ त भन्दा drugsले हुन सक्छ. Drugs such as methotrexate, busulfan, यो सबैले चाहिँ के गर्ने हो त bone marrow depress गर्ने हो है. Congenital forms मा पनि के हुन्छ त bone marrow suppression भएर anemia भएको हुन्छ. त्यही भएर pancytopenia हुने हो, हैन. अनि यो acquired form मा पनि these are the acquired forms highlighted for you, है. यो चाहिँ acquired forms-हरु हो, है. Acquired forms मा पनि bone marrow suppression भएर pancytopenia हुने हो, है. So के हो त acquired form केले गर्दाखेरि हुन्छ? Drugs ले गर्दाखेरि हुन्छ. You should remember some of these important drugs, है. Some drugs याद गर्न it's not possible, but some of these important drugs such as your cancer medications such as methotrexate, busulfan, penicillamine, chloramphenicol, sulfonamides, phenytoin, carbimazole, chlorpromazine. These are some of the drugs that you should remember, right? Sometimes they might get asked. अर्को चाहिँ केले हुन सक्छ त irradiation हुन सक्छ अर्को इन्फेक्सनले हुन सक्छ है प्लास्टिक एनेमिया अर्को चाहिँ there is something called paroxysmal nocturnal hemoglobinuria है त्यसले पनि hypocellular bone marrow गराउन सक्छ will come to it later यो कसरी हुन्छ भनेर त्यसले पनि प्लास्टिक एनेमिया गराउन सक्छ है paroxysmal nocturnal hemoglobinuria So there's going to be hypocellular bone marrow when we take bone marrow biopsy, hey? Okay, यसको clinical picture चाहिँ के हुन्छ त? There's going to be clinical picture of pancytopenia. So what is a clinical picture of pancytopenia? एउटा त anemia के signs and symptoms हुने भयो, fatigue, shortness of breath, अनि tachyarrhythmia हुन सक्छ and all that, है? त्यसपछि के हुन्छ त? WBC low भएर, leukocytopenia भएर, infectionsहरू हुन सक्छ, हैन? And purpura हुन सक्छ thrombocytopenia भएर. So you will have the person's going to have clinical picture of pancytopenia. Okay. And this is CBC मा पनि you're going to see pancytopenia plus reticulocytopenia because the person is not being able to produce RBCs है त्यही भएर चाहिँ immature RBCs पनि produce गर्न सक्दैन so reticulocytopenia हुन्छ त्यसपछि bone marrow examination मा obviously there's going to be hypocellular bone marrow अनि त्यसपछि चाहिँ increased fat spaces पनि हुन्छ है bone marrow मा okay this we've done it. Okay, so let's talk about the treatment of aplastic anemia. Treatment the first thing we need to do is avoid any causative agent. If there is any other causative agent such as any infection that caused it, just treat it. Avoid and treat any causative agent. Right? Transfusion therapy when we can give the person whole blood or packed red blood cells or platelets according to the need. Prophylactic पनि हुन सक्छ है prophylactics is specifically the person is very prone to infection किन भन्दा his WBC is going to be very low so उसलाई चाहिँ isolate गर्ने he's not supposed to go around in places where he's prone to infection so we can isolate the patient we can give him prophylactic antibiotics or antivirals and there is something called granulocyte colony stimulating factor we can give this to increase the neutrophils neutrophils increase गर्नलाई चाहिँ यो दिन सकिन्छ we can also give him we can also transplant stem cells to this patient केही गर्दा पनि भएन भने there is also a last resort that is allogenic stem cell transplantation transplant stem cells to this patient or immunosuppressive therapy पनि we could try such as we can try giving him steroids we can try giving him cyclosporines so this is about the aplastic anemia. Now let's talk about the hemolytic anemia. Hemolytic